Hi.
Hi, how you doing?
I'm doing great. How are you?
I'm doing well. This is Jay Cutspec. I am the Director of Health and Counseling, and I've been here about 12 years.
Okay. All right. So explain to me, what exactly is COVID-19 or the coronavirus?
So COVID is a new coronavirus that's never been identified in humans before. It started in Wuhan, China, and it really creates respiratory symptoms for individuals. It has never been identified in any other human, and so it's really a novel virus that we don't have a lot of information about.
Oh, okay. All right. So UNCA has implemented safety procedures on campus. Would you like to walk us through what we have done here on campus?
Sure. Well, the UNCA leadership actually developed about a 56-page plan prior to students coming to campus. So there were a whole lot of strategies we used as a way to curb the spread of coronavirus. Some of the things that I'll just mention to you is we looked at putting plexiglass in places where the public is interacting with either staff or student workers. We've put directional signs in the buildings so that there's one exit, one entrance, and that people are walking generally in the same direction. All of the classrooms on campus, the desks are 6 feet apart from one another as a way to maintain the social distancing. We've put limits on the number of people that are allowed in the dining hall as a way to curb the growth. The other big thing we've done is put hand sanitizer stations almost everywhere on campus. It'd be hard pressed to not find one if you were looking for one. But those are just some of the few things that we did.
Well, how does stuff like masks and how does this distancing that we've created here, how does that help reduce the spread?
So the three things that students can do to prevent the spread are wear a face covering, maintain the social distance, and the third one is disinfect commonly touched surfaces. And so why that is effective is we know that the majority of the coronavirus is spread through droplets that people release when they're either talking, sneezing, or coughing. And so those droplets are released in the air and they ultimately drop. But while they're in the air, other people can ingest them, and that's how they get sick. And so the face coverings obviously prevent those droplets from, they still come out of the mouth, but they sort of stay within the mask, so to speak, for the most part, not totally. The social distancing aspect is effective because even those droplets that do get beyond the mask, those people are far enough away that they're not going to ingest them. And then the surfaces, obviously, we know that coronavirus can live on surfaces. We don't know if you can really get the coronavirus in that way. But we obviously have to be conservative, and so that's why wiping down surfaces is an important aspect of this prevention.
Okay. All right. Well, studies have shown that it's mostly if you're a young adult such as myself or something like that, you aren't really at any sort of danger from the coronavirus, but we're still putting in these safety precautions and whatnot. So if young adults aren't entirely in danger from COVID, then who exactly is?
It's important to note that people of any age can get COVID. So a baby can get COVID, an elementary school student, a college student, everyone gets COVID. What we're looking at is the prevalence of getting COVID is really different depending on the age group. But all age groups can die from COVID, all age groups get the symptoms, all age groups can recover from COVID. What we do know, however, is people that are over 60 and people with underlying health conditions are going to feel the impact of COVID more than the younger population. So that those particular groups of people have to be especially careful in not contracting it. And when they do get it, they need to make sure they get medical care promptly and quickly. As a matter of fact, in North Carolina right now, the biggest group of people that are contracting new cases are between 25 and 45. So young people do get it, they just don't get as sick as some of the older people that get COVID.
They could be, what's the word?
Asymptomatic.
Asymptomatic, yeah.
Which means they have COVID, but they don't develop any symptoms. What we've learned, though, is many people who say they were asymptomatic, when you really go back and talk with them and ask them specific questions, that they really probably did have some very mild symptoms that they didn't recognize as being sick.
Yeah, okay, that makes sense. Yeah, so that's just kind of almost like a phantom kind of thing, like a phantom menace sort of thing.
Yes.
So this is kind of crazy time, especially for it's a fall semester, so we have a lot of newcoming students to the campus. So what would you suggest to newcoming students that are just having to start college in a pandemic? Like,
well, I think the first thing we need to have them do is to be healthy. And the way the best ways for them to be healthy are wearing a face covering, staying 6 feet away from folks, but also more importantly, particularly with college students, is staying out of crowds. We know that coronavirus spreads very quickly in crowds, and for college students that can mean a party situation. And so trying to avoid those more risky situations would be a way to stop the spread of it. Now, in terms of the mental health aspect, it's really important to maintain connections with your social support system. So that might be your family if they're back home, and obviously maintain your social circle that you have here at college.
Okay, yeah. So finally, last question, and it's going to be, so for your office in particular, and also UNC as a whole, what are your hopes for this semester?
I have 2 goals that are very clear and very specific. The first is I obviously want to minimize the spread of COVID amongst faculty, staff, and students. So we really want the virus to be minimal here on campus, which I think we've achieved so far. And then the second thing, I really want to ensure that our campus stays open until November 20th. We see campuses around the country closing due to COVID, and I really want to continue our current schedule of classes and our current living arrangements for all of our students until November 20th, as we had planned.
All right. That sounds great.
Does that work?
Yeah, that's good. Thank you so much.